Riverside. She's a well-known expert on political psychology. She's the author of 2 books, one called Democracy at Risk, that came out in 2009, which was very prescient, I think. And the other is Framing Immigrants, News Coverage, Public Opinion, and Policy. She's also the author of many, many articles on political psychology and other topics as well. So thanks so much for being here today, Jennifer, to talk to us. Her talk today is about emotional reactions to COVID-19. Take it away.
Thank you so much. I'm going to share my screen, and thank you so much for attending. I know it's always so hectic toward the end of the semester, so I appreciate your time, and thank you to Andy and Fernando for coordinating, and Eileen also was great in getting kind of all the logistics set up. So thank you. This is collaborative work with a whole bunch of folks at UCSD, as well as Mindy Romero at the University of Southern California. And this is I think this is the first time I'm actually presenting this project, and it's part of a larger project that we've been doing, kind of looking at the effects of some exposure to information about COVID projections and support for vote by mail. But here we're expanding what we're looking at to look at some mechanisms through which people may react to COVID projections and the consequences those might have for kind of engaging in personal protective behaviors to mitigate against the virus, as well as support for protective policies. So I want to take us back, let's see, kind of last March in my state here, California, was one of the first states to take the really drastic action of kind of locking down in an effort to flatten the curve. So there were a number of protective policies that were kind of put into place, and we were really an early mover in that. My family was very compliant. This is us in the summer cases had gone down, but there were still mask mandates. So we were kind of complying with those directives. As many of you know, even though things kind of were better and cases were better, at least in California, we went into another lockdown in December as cases were on the rise. And again, the kind of mask mandates were still in effect. This is, of course, just California, but there's been, of course, efforts at the national level. I know this may be hard to believe, but kind of Trump himself did tweet a photo of himself in a mask, calling it patriotic at one point. And of course, we saw, encouragement from Biden that people engage in protective behaviors like wearing a mask. And of course, the same was true for Dr. Fauci, who became a household name, sharing information about the pandemic and encouraging a range of protective behaviors to combat the pandemic. Now, of course, this presents a picture where, as if there was consensus. We all know that's not the case. Here's just an example of variation in states that require masks, and this is as of, I think this was in March of this year. So you can see a number of states still have a mask mandate. Others never kind of implemented a statewide mandate. Some have already dropped their mask mandate, even against kind of the recommendation of health officials, and others are in the process. Now, of course, this is, ever changing. There's been new guidance issued, especially for those who are vaccinated, right? So the kind of goalposts are always shifting a bit. But we do, of course, see this variation in policies at the state level. And this is one example, of course, of protective policy. So not only is there variation kind of in policies, but there's also, of course, important variation in public opinion. So in both kind of red states and blue states alike, there have been protests against these types of protective policies throughout, much of the pandemic. And this is an example from kind of LA's City Hall, where people are kind of protesting the mask mandate in California. And really, there was a big push to try to reopen the state sooner. We also, of course, have seen a lot of variation at the level of elites in messaging around protective behavior. I showed you an example of Trump wearing a mask, but as many of you know, He also kind of mocked Biden for wearing a mask right on the campaign trail. So he had very mixed messages on mask use. Some Republican leaders, refused to wear masks in the Capitol. And so the information environment, at least for the public, is one that has kind of, shifted over time to mixed messaging on encouraging kind of protective actions and policies. And so it's probably no surprise that we also see variation in public opinion, where, there's, a lot of people say that they wear a mask all or most of the time, right? But it's certainly not universal. And we also, right, see kind of variation in support for a range of protective policies, like, wearing a face mask, whether we should restrict air travel, whether people, should be asked to avoid gathering in large groups. And so, what we really wanted to understand in this project was some of the factors that might lead to, greater support for protective behaviors and protective policies. Now, there's been a lot of scholars are starting to look at this question. There's already a fair amount of published research. And so scholars have found, for example, that certain groups, are less concerned about COVID-19 and are thus kind of less supportive of protective behaviors and policies to address the pandemic. And so just to give some examples, we know this is the case for Republicans. And scholars have shown this not only with kind of public opinion data, but also behavioral data. This is also the case among men, whites, evangelicals, and those in rural communities. Now, another thing that scholars have been looking at that kind of, I think I hinted at in some of those earlier slides is, part of this may be linked to the information environment that people are exposed to. And so what we know from some existing research is that, our own lived experiences, right? We're all living through this, is that the, COVID-19, the pandemic became increasingly politicized. So kind of more of the spokespeople in news media were not necessarily scientific experts, but kind of political elites, and also more polarized along partisan lines in the media over time, right, over the course of the pandemic. Some studies have shown that right-leaning media outlets were more likely to contain misinformation about COVID-19, and that had consequences for kind of attitudes toward protective behaviors. And so, and other studies have linked exposure to different types of news coverage to views about the pandemic and support for different protective policies. So, for example, those exposed, primarily that tune into Fox News, right, are less concerned about COVID-19 and hence are, less likely to support protective policies compared to individuals who tune into kind of traditional news outlets. Now, what we're interested in this paper is looking more at how the public reacts to scientific information about the pandemic. There's been a little less work done on this question, but we think it's particularly important, especially given that, right, most days when you kind of open up the newspaper, there's some type of scientific information related to COVID-19 cases. And we know from prior research that, the public is generally more trusting of kind of scientific experts during healthcare crises. And so we really wanted to, in a sense, hone in on that type of information. And the other thing that we're interested in was exploring some mechanisms through which kind of information about the pandemic may influence kind of policy attitudes and behavior. And here we really wanted to look at the role of emotional reactions. We know from prior research that under context of threat, individuals are likely to experience many different negative emotional reactions, and those can have important consequences for policy preferences and behavior. And so kind of the key question that we were interested in is what type of emotional reactions does the public have when they're exposed to scientific information? And what we look at in this project is information about the likely progression of the pandemic, right? So these are predictions about kind of future case counts, right? This was really salient, especially early in the pandemic when we were designing our studies. Kind of tuning into the news every night, there would often be, right, these projections that people were being exposed to. Given the increase in politicization and polarization, especially over time, we were also interested in whether these emotional reactions vary over time and by kind of partisan identity and partisan attachment. And then finally, to connect back to our interest in policy attitudes and personal behavior, what consequences do these emotional reactions have for whether people are more or less inclined to engage in protective behaviors and support for protective policies to address the pandemic? So these are the questions that really motivated the current project. Oh, and I should note, I forgot to say that I'm happy if there's any kind of questions that folks have along the way, I'm certainly happy to answer them. Okay, so I want to step back a little bit to talk a little bit about some of the research that's been done both in political psychology as well as social psychology on emotions and what consequences they have for attitudes and behavior. So what we know from a lot of the research is that any type of text of threat, including COVID-19, is likely to be unpleasant, It's caused by something that's kind of outside of the individual. And it involves a great deal of effort to deal with the situation. And we know this can lead to a really wide range of negative emotional reactions, It can lead to greater fear and anxiety, greater anger, sadness, and disgust. And what I want to talk about a bit today is that kind of which emotion is more dominant in a context where people are experiencing threat or exposed to information about that threat, depends in part on how they appraise that threat, the way that information about the threat is conveyed to the public, and some characteristics of the individual. Okay, so here I'm drawing from cognitive appraisal theories and social psychology. And what we know from some of that literature is that individuals are more inclined to feel kind of greater fear and anxiety when they're in a context of threat that's kind of higher on uncertainty, if they feel like they have little control over the situation, if their attention is really tuned into the threat, and it's not really clear where to place blame, They don't know who to blame for the threat. Now, sadness is actually quite similar to fear and anxiety, at least with respect to many of these different appraisals. It only really varies in that when people are feeling sad, they are more interested in diverting their attention away from the threat. Now, on the flip side, individuals are much more likely to feel kind of anger as a dominant emotional reaction when there's less uncertainty. If they feel like they have a greater sense of control over the situation, they still are tuned into the threat, but they do have a sense of who to blame for it. So they kind of feel like, oh, wait, I know what the cause of this threat is, and so I can place blame on someone else for the feelings that I'm experiencing. Disgust is also a negative emotion that's similar in many regards to anger. The key difference, though, is that often people, when they're feeling disgust, want to divert their attention away from the threat. And that is more likely when the threat may be a contaminant. And so a number of scholars have studied this particular emotion as it relates to kind of public health crises, because often, it's dealing with a contaminant, and so people want to kind of remove themselves from that threat. Okay, so that's kind of the first important feature of the types of emotions that may be more dominant when people are exposed to information about a threat, including one like COVID-19. Now, but what's also important is the way in which information about the threat is presented to the public can kind of affect these appraisals. So, for example, if information, such as the type of information we'll be looking at, is highlighting projections about future cases, that's highlighting a degree of uncertainty, related to how the kind of virus is likely to progress. And because there's higher uncertainty, we therefore may see higher levels of fear and anxiety. And there's a little sense of control, We're kind of making predictions, but we're not really sure what's going to happen. What can we do to control this? Sadness is quite similar, but we may see kind of higher sadness if the information is really focused on, say, deaths from COVID-19, So if death is kind of the key metric that's being presented, we may observe elevated levels of sadness. Now, anger may be more likely if information that people are being presented with kind of is placing blame on others for the virus, right? We saw, just to give an example, a lot of this type of information coming from President Trump, right, who would kind of associate the virus kind of with China, right? So that's a lot of language around blame. And so that might lead to elevated anger. Now, existing research suggests that disgust is much more likely to be evoked when information focuses on bodily symptoms and fluids. Now, since what we're going to be looking at in this project is much more about scientific information about the likely peak of COVID cases, we expect that fear and anxiety, as well as sadness, will really be the more dominant emotional reactions to the type of information that we are presenting people with. We also expect that this should be kind of a little bit more pronounced, especially earlier in the pandemic, right? As it's newer to people, more novel, they may have stronger emotional reactions to that information. Now, the final component that we're interested in looking at is kind of how kind of reactions to this information may vary depending on people's partisan attachments. What we know from some existing literature is that when threats, like COVID-19 are not framed in political terms, so they're not really politicized and polarized yet, we may not really observe many differences across partisan groups and their reactions to that threat. However, right, as threats become more politicized and polarized, individuals might filter information through their partisan dispositions and kind of reject information that may be inconsistent with their dispositions. Now, since COVID-19 became increasingly politicized and polarized, right, over the course of the pandemic, we might expect that over time, Republicans become a little bit more resistant, right, to reacting emotionally to kind of information about the likely progression of the virus. Okay, so, I'm of course very interested in the effects of threat on emotional reactions, but also because, right, I'm interested in how that connects to people's behavior and attitudes. And so what we know from research on emotions is that the type of emotional reactions and the kind of dominant emotional reactions that individuals experience can have important implications for the types of policies that they are supportive of and personal behavior. So when individuals are feeling a higher level of uncertainty and lack of control, and so greater fear and anxiety, as well as sadness, it kind of leads to a greater desire for protection. And individuals, studies have shown that they're more likely to engage in kind of defensive behaviors. We expect that these motivations, right, should also translate into support for policies to provide protection against the threat. Scholars have found this to be the case in, with respect to other domains, not necessarily public health threats, but also looking at, some scholars have found this also for kind of health threats prior to COVID-19. And so we expect kind of a similar mechanism in place whereby kind of exposure to scientific information, if it leads to greater kind of fear, anxiety, and sadness, it should lead to support for kind of policies to address the pandemic that are defensive in nature, and people should be more inclined to engage in protective behavior themselves. Okay, so just to summarize some of our hypotheses that we had going into this project, we expect that exposure to scientific information about the projected case counts of COVID-19 should lead to higher levels of anxiety and higher levels of sadness. We expect that these reactions will be moderated by an individual's partisan identification, especially as a threat becomes more polarized over time. And then finally, we expect that those who experience elevated fear and anxiety, as well as sadness, should in turn be more inclined to support both kind of personal protective behaviors as well as kind of policy responses that provide protection from the pandemic. Okay, so how do we go about testing some of our expectations? We fielded 3 studies on Lucid Fulcrum's platform, and we used 3 different waves. So our first study was in the field, fairly early in the pandemic, so in kind of mid-April. We went back into the field 2 months later, and then finally went into the field again in August. And so, we thought this would be nice to be tracking, right, some of these reactions over time to see if, again, some of the reactions get a little bit weaker over time, as well as to see whether reactions by different partisan groups start to shift over time as the pandemic became more polarized. Okay, so this is our experimental design. We did just provide people with text, and it was a pretty short treatment group. So we randomly assigned people to a control group that didn't receive any information about case counts. And then people were randomly assigned to one of two kind of predictions. And we used actual predictions that were out there. So one of the models, and this is by a team of scientists, projected that the main peak would be in the spring. Now, looking back, we know that was, not the case, but this, our studies were in the field much earlier. And so, people read that there may be this, the peak was in the spring. And the other condition, this was by another team of scientists, the projected peak was in the fall, right? And so kind of one thing we were interested, is kind of it wasn't part of our main hypothesis, but we were interested if people react somewhat differently if they're taking the study and the projected peak is further out in the future, right? Would that lead to even a stronger emotional reaction? And then support for, greater support for protective policies and behaviors. Now, I should note, we didn't include the name of the teams that kind of made these projections because we didn't want that to be necessarily confounded, right, what the source of the information was. So we just kind of kept it generic across these conditions. But these are actual predictions, so there was no deception in the information that we were providing. Now, by the time of our August study, of course, it really didn't make sense to be focusing on a spring peak. So we only we're going to use one condition, talking about a peak in the fall. And we also, just to think about issues of external validity, wanted to test out a slightly different presentation for kind of focusing on case counts. And so this one is giving information about cases, hospitalizations, and deaths. And it's showing a graph to kind of, combine with the text that we had only used text in some of the prior studies. And so this is what those that were assigned to the treatment condition were exposed to in August. So that was a basic design. So people were randomly assigned to one of these conditions, and then they filled out a battery of questions about their, emotional reactions, which I'll talk about in a second, as well as a range of policy preferences and kind of attitudes about personal behaviors. Okay, so to measure emotional reactions, we used measures that are pretty standardly used in the literature. And so this asks people to indicate the extent to which they're feeling a particular emotion on a 5-point scale, from not at all to extremely. And we followed a lot of the advice in the literature. I think actually some of this is from a paper that Jenny wrote looking at, so we asked to kind of tap into anxiety, the extent to which people were feeling afraid, anxious, or worried. For anger, we asked about contempt, bitterness, and resentful. We added in some questions around disgust because so much work has looked at disgust in dealing with kind of emotions and public health threats, even though we didn't think it would necessarily be as relevant for the type of information we were presenting. We still wanted to have some instrumentation, and so used grossed out and repulsed. And then finally, we only have one indicator of sadness. So we just ask people the extent to which they're feeling sad. There's been, much less work on this particular emotion, at least in the political psychology literature. So we do have just that one measure in our studies. So these were all kind of combined. Well, we do have multiple indicators. They were combined into scales. All of the alphas were very high on these scales. And so that's what we'll be kind of analyzing in our analyses. Okay, so kind of the first thing we, ask is just, does reading any scientific information about projected case counts impact emotional reactions? And so for this, we're pooling together the treatments. We did have some issues. We, asked questions about, to gauge whether the extent to which people were paying attention to the information. And about half of the sample could correctly identify if they were in the treatment group when the peak in the cases would be, right, depending on what treatment they were in. So compliance wasn't particularly high. So we wanted to analyze the results both kind of pooled, if you're given any information, as well as separated. And so I want to draw your attention. We can look first at kind of fear, anxiety reactions. And so this is kind of each wave. We were just regressing whether they were exposed to any of information about peaks relative to the control group. And so what you can see here is, right, across each study, exposure to, right, kind of information about a peak in cases relative to no exposure led to higher levels of fear. That effect, you can see, is kind of more substantial in April, right, early in the pandemic. It gets kind of smaller, right, with each subsequent wave, right? So those effects are stronger earlier on. We see very similar effects when we look at sadness, right? So kind of exposure to information about case counts led to greater sadness in April, June, and August, but the effect again is kind of strongest in April. As I mentioned, we didn't really have strong expectations for anger because, none of the information in our treatments would necessarily lead to greater anger. And we don't really find any effect in April or June. We only find an effect, and it's, a marginal effect in August. And we also don't really find, we only have the kind of measures of disgust in our June and August wave. We don't find any increase in disgust. If anything, we find this kind of decrease in disgust, which is a little bit puzzling in our June study. And then finally, kind of across the board, we find that people are kind of less optimistic and enthusiastic when they read about case counts, as you would expect. So we find pretty consistent evidence for the emotions that we thought would be the ones that would most likely be affected by reading information about scientific projections, and not for the emotions that we didn't think would be, as affected.
Jennifer? Quick
Yes.
question. There's a question in the chat that says, for interpreting results, will we read these beta coefficients as change in the emotional scale?
Exactly, yeah. So it's the,
deviation?
yes. Oh, thank you. Yes, thanks for that question. So this is, yeah, so, basically the kind of strongest effect, right, is kind of in April for, right, movement on that scale for fear and anxiety, and people exposed to the treatment condition move about a unit on, right, that scale. And I should have said, right, the scale itself goes from 0 to 15 for fear, right? So it's not a huge effect, but people are shifting a full unit on the scale. But all the other effects, right, are much smaller than that.
Thanks.
So that's a great question. Thank you for, I'm on a small laptop, so I can't see the my slides in the chat very well. No, that's great. Thank you. Okay, so the next question we might ask is, right, does the effect vary depending on whether people were in that fall peak condition or spring, right? Because you might imagine if you think the worst is yet to come, right, you might have a stronger kind of negative emotional reaction. The kind of, if we look at the coefficients, right, it's larger for the fall peak relative to the spring peak. But if we test, right, whether those are statistically different from each other, they're not. Same in June, the kind of coefficient itself is larger, but it's not statistically different. And the same is the case for sadness, and any other emotion that we look at. So we really don't find any kind of differential reaction depending on whether people are reading about a fall peak or a spring peak, right? So it's just really any information about case counts is affecting emotions pretty similarly across, right, these the two waves where we use those two different treatments. In August, we only had kind of the one projection. Okay, so that's kind of the effects on average. Of course, we were also interested in whether reactions vary by partisanship and how this may change over the course of our waves as a pandemic became more polarized. And so here, what I'm showing you is the predicted level of fear by the experimental condition that the respondent was in, as well as their partisan identification. And so in the figure, blue, right, the folks in blue are Democrats, right? So you can see that, right, kind of shift Democrats in the treatment group, right, have higher levels of fear than Democrats in the control group. Red are Republicans, right? They're, in the control group, they're less worried, right, and less fearful than Democrats. But when they're exposed to the treatment condition, right, they also experience elevated fear. And if anything, their reaction is actually a little bit more pronounced than it is among Democrats, right? So all partisan groups, at least in April, when they read about projected case counts, they experience greater fear, but the kind of effect is actually a bit more pronounced among Republicans. And actually, we find that, pretty similar effects among independents are in gray, and those are pure independents, the folks in gray. Now, if we look to June, right, we have pretty similar effects, right? We still see just in the control group that Democrats are more kind of worried than Republicans and independents. Democrats, it looks like they shift a little bit, right, to be more fearful, but it's not statistically meaningful. However, Republicans, right, that kind of treatment effect is still significant among Republicans. I'm showing you the results for the kind of pooled conditions, since we didn't really see, much difference in that first set of analyses if we broke it down by whether respondents were exposed to the fall or the spring peak. If we look, the results are very similar whenever we kind of break down these partisan results by a fall or spring peak, but Democrats, this kind of effect that's insignificant for the pooled conditions, when Democrats were exposed to the fall peak, they did experience greater fear. So we do see some movement, but only for one of the treatment conditions there. Now, finally, in the August wave, and so this is kind of at the context of, right, there's kind of more campaigning going on for the presidential election. The pandemic, of course, became more kind of politicized and polarized. This is when, Trump is holding many rallies where many people are kind of going maskless. Just to give an example of the political context, we still see pretty similar, right, reactions to reading about, right, projection of future cases among Democrats and independents. But now we see, right, Republicans, if anything, the point estimate in the treatment condition is lower than it is for the control group, and it's not statistically meaningful. So Republicans, by our August wave, are no longer kind of reacting with greater kind of fear to reading about future case counts. So we start, and that's kind of what we expected to see as the pandemic became more polarized. If we look at the same set of analyses, but looking by sadness, we observe very similar effects. And so, right, kind of in our April wave, kind of all of our different partisan groups, when they are exposed to case counts, experience greater sadness. Only Republicans really do, right, in that kind of June wave. Unless, of course, again, we break down Democrats in the fall peak condition become sadder. But by August, right, Republicans no longer experience greater sadness. It's really only Democrats who still experience greater sadness when they read, are exposed to information about case counts. Okay, so we do see this kind of variation over time in emotional reactions, as the political context is shifting. Now, our final question, of course, is, okay, so why should we care about all these emotional reactions, right? What difference do they make for kind of thinking about kind of politics and policy outcomes? And so, as I mentioned, right, from some of the literature, expectation is that, right, if individuals feel greater fear and greater sadness, they should be more likely to engage in kind of behaviors to protect themselves. And so we asked on our survey to help prevent the spread of COVID-19, how likely respondents are to engage in the following activities. And so these were on a 4-point scale from not at all likely to very likely. And so you can see the list here, right? I'm sure many of us were engaging in these various behaviors throughout, right, the pandemic at various stages. And we just created an additive scale from all those measures, and the alpha is quite high on those. And so what we do, right, because we expect that this is, an effect that is mediated, we use the approach by Amai et al. For causal mediation analysis. And so I'm going to kind of highlight the average causal mediation effect. And so this you can think about as kind of, right, the treatment leads to greater fear and greater sadness, and how does that in turn influence intentions to engage in personal protective behaviors, right? And this is just intentions. We don't have if people are actually engaging in protective behaviors. It's just self-reports. So we can see right across all of our waves that average causal mediation effect is positive and significant, right? So those who experience greater fear were more likely to say that they would engage in personal protective behaviors. One important thing to note is there's no direct effect of reading about COVID projections, right? The effect is really only meaningful as it works through the emotional reaction. And so we think this is really important because, it just showcases why emotions may be an important mechanism. And it's not that other mechanisms might not be in play, but at least, we can see that, fear kind of operates as we expect. And we see the same type of relationship through sadness. And so individuals that experience greater sadness are also more inclined to engage in personal protective behaviors. And finally, we looked at with what consequences for policy attitudes. And so we asked people for their level of support or opposition to a pretty wide range of policy responses. So some of the shelter-in-place orders, government spending to help people who've lost their jobs to COVID, making COVID testing free, all the way to kind of a more expansive medical care for all. So we asked about Medicare for all in the survey. We also used an additive scale here, and the alpha was quite high. And again, we're in the same type of causal mediation analysis. And you can see very similar effects to what we see for personal behavior, right? So individuals that came to experience greater fear reading about scientific projections were more supportive of a range of protective policies. And so we saw that in each of our waves. I should say this is April, it's missing the labels here, April, June, and August. And then the same effects, right, for sadness. And again, we really don't see much in terms of a direct effect of the treatments. It's really just as it works through emotional reactions. And if anything, right, in one of the waves, so this is in April, the information actually made people less supportive, just the direct effect of the treatment on support for protective policies. And I'm not showing the other emotions, but in part because our treatments didn't consistently impact anger or disgust, right? So then they couldn't have this kind of indirect effect. And in the paper that we're working on, we also report the effects through, feeling greater enthusiasm. And the effects for enthusiasm are actually a little bit more mixed. They make people a little bit less supportive of protective policies, but people are still kind of likely to engage in protective behaviors. So it's a little bit puzzling on some of those, mediation effects through thinking of more positive emotions. Okay, so, as expected, we find that exposure to scientific projections about case counts, increase fear and sadness, but not anger or disgust. And again, this is linked in part to the type of information that we're presenting. We did see important differences by partisanship over the course of the pandemic. And as expected, these particular, right, elevated emotions did lead to some greater support for engaging in protective behaviors, as well as policies to address the pandemic. I think the thing that we found most surprising was that we didn't see more, a greater difference between people's reactions to kind of reading about a peak in the spring or in the fall. So we still are, kind of trying to tease out why that might be the case. Kind of one question that arises kind of from some of this research is whether, right, there's any messaging that can work once public health crises become really kind of polarized and politicized, right? Is there any way to kind of persuade those who become less inclined, right, to engage in protective behaviors, even if they, may be quite important? And so I've been working on a slightly different project related to that question with some kind of former Dukies that I went to grad school with. We started chatting a little bit about, we were kind of joining some folks, so Brian Newman and Liz Eckmeister, we all went to grad school together, and then a student at UCR. And so we've been testing some messages that may actually persuade those, right, who may be resistant to things like wearing masks, to be more inclined to support various policies around mask mandates and thinking they're more important. I know we're running low on time, so I'll just very quickly show you. We kind of tested, we were looking only at white evangelicals who have been more resistant, to wearing masks. And so we tried out kind of a religious message of, kind of wearing a mask is something that, kind of supports your neighbor. It's a very kind of classic religious argument, as well as, right, that picture I showed you of Trump, right, telling you that it was patriotic to wear a mask. We tested that on this particular study. And we did find that these, messages, that are coming from, so in this case by President Trump, the religious message was either just the message or from evangelical leaders that did kind of have, especially that religious message, it did make people think wearing masks is more helpful and important for their community to do. They thought it was more important for Trump to wear a mask, and they were slightly more supportive of mask mandates. The patriotism message was not kind of necessarily effective in the full sample, but it was more effective among those who identify as Republican, right, across most of those measures. So that's just a little, I know I'm just throwing one study at you very quickly, but just to show that even, though we might find, some types of information might, make people, they may stop reacting emotionally to it, like scientific information. As the pandemic becomes more politicized, there may be other ways to provide other informational interventions that can still kind of move people's attitudes and support for different protective policies. So I will stop there, and I'm really looking forward to your questions and suggestions. So I can see some things. So I see David has a question.
Yep. I don't want to jump too, if you've got other people, go ahead. But I do have a sort of curiosity question. Mm-hmm. And I should start, I'm an international relations scholar, so I'm going to talk about findings that I think I read in American politics, but you may tell me that I misunderstood. I recall a set of studies that were done that attached American Republicans to high fear. I think they put people in these brain things, and they showed them pictures of spiders and things, and the people that had really strong fear reactions. So how would you put that body of research next to your finding that the Republicans just aren't that fearful in response to messages about the dangers of COVID?
No, that's a great question. And yes, I am familiar with, some of that research that you're talking about. And, I should note, right, in our control group, right, Democrats were more fearful about COVID. However, it wasn't a huge difference, right? Like they were basically only about, right, kind of 1 unit on a 15-point scale in terms of, right, their kind of levels of, fear with respect to, at that particular point in time. Now, so it's not a huge difference, but, we might expect that maybe they would be higher in the control group given some of that research. But I think the important point is they react more strongly very early in the pandemic when it was less polarized and politicized. So, once you have elites from the political party sending mixed messages, right, about the severity of the crisis, right, that's when you start to see that they react with kind of, well, basically they don't react, right, with any greater fear when they're exposed to case counts. So I think they are behaving, at least in reaction to the information, consistent with some of that other literature, because we do find slightly stronger effects for Republicans in April and in June, right, relative to Democrats. It's not until we see much greater polarization that we start to see, kind of that the treatment no longer has any effect. And some of that early work is just about kind of, a general inclination to experience kind of greater fear, with respect to the environment. What we know from other work is once things become polarized, right, we expect the types of patterns that we're finding in our studies.
Thank you.
Mm-hmm. So I think maybe was John may have been next.
Yeah, hey Jen, hope you're doing well. It turns out it was probably not a great day for you to come to Boulder from Southern California. It's like raining cats and dogs. So anyway, good to see you. And thanks for the talk. So my question is about this interesting kind of change over time with respect to Republicans that I think stands out. And you've explained it as sort of a presidential election campaign or messaging or effect. And I'm wondering if alternative explanations might lie in geographic differences in experience with respect to both the pandemic and the economic consequences of it. So in other words, being a Republican is probably correlated with living in certain states or even certain counties within states. And we know that temporarily that the pandemic affected different regions and different states at different points in time. And so if you look in August, for example, some states had experienced declines in the pandemic in the preceding 30 days, others might have been flat, others might have been increasing. And so, and then similarly, the local economic circumstances might be quite different depending on restrictions that are in place or the incidence of the pandemic locally or whatever it might be. And so I think you have one potential explanation, but I'm wondering if there's a way to get at these competing explanations, maybe just through controlling for them, perhaps. Yeah, I mean that might be the way to go about it, at least at the state level, if not more locally. So.
Yeah, no, those are really great suggestions, and our data was drawn to be nationally representative, but there's such large samples that I think we could pretty easily, right, incorporate. We'd at least have a fair amount of variation, right, on those dimensions at the state level. I don't know about, local context, maybe a little bit trickier given, right, the nature of our sample, but I think certainly at the state level, we'd be able to incorporate some of those, measures, because those all, are likely plausible, right, explanations, right? If cases are, further down where you live, you might kind of discount information about future peaks, right, of the virus, and that could, certainly be an alternative explanation. And we know that's also, right, varying across the course of the pandemic. So that's a really useful suggestion.
Yeah, and then I'm just in general interested in the interplay between the virus and economic circumstances that, in other words, I mean, I think maybe the protective model is helpful for you in that regard, because when you're picking up fear or anxiety, it could be that it's either partially the economic consequences or entirely the economic consequences that's being triggered, as opposed to purely the illness itself. So I think it's great that you have the PPE piece to it, to reassure us that it's that the emotional impacts that you're observing are tapping at least partially into virus-related anxiety or sadness. So.
No, that's a good point. And one of the measures we did have, for policy attitudes is about also not just protection from the virus, but protection from economic consequences, right, of the virus. Because we did ask, just about support for people who have, lost their jobs because of COVID. I don't know if we've looked at that separately to see if we're finding any different patterns.
Well, I'll let someone else.
But no, it's a
Thank you,
great,
yeah.
so thank you so much for,
Thanks.
these suggestions. That's great.
Thanks.
I think Jeremiah.
Yeah, thank you, Jennifer, for the very interesting talk, and for extending it here with some of the other research you're thinking about doing and working on already. I had a number of questions, one of which was a geographic question. So you've answered that in part from what John was. I was curious, given how large your sample size was and that it was a national representative sample, if you might be able to parcel out some of those differences based on where the virus was most hard hitting, and perhaps even by states that had policies that were locked down or more open. You set it up initially thinking about some of that way. So I don't know if you have a large number of samples for that, but I'd be really curious on that too. So I'll ask a different question said here. I'm curious whether, and this is, asking you to step outside of the results that you did here, but just thinking about it in terms of uncertainty levels. So as time went on, we collectively as the general public had more and more information about things that were going on. We had perhaps some less uncertainties in some areas, maybe more in others. But I'm wondering how that might have played out here, whether you think it might have had a suppressive effect on people's emotional responses through time, or perhaps an elevated one, as John was pointing out from the Republican standpoint of things. And the follow-on to that one is from a messaging standpoint, which is what it looks like you're already doing here, whether or not the messages changed over time. Because I'm thinking that from a Republican standpoint, it was initially a little more dismissive of the potential threats. And then as more evidence, the weight of evidence became like, hey, we need to be paying more attention and probably doing some things differently. And if that might account for the increase in some of the emotional responses from a Republican Party standpoint through time. But curious, so do you have any sense for what that looked like with change in uncertainty and availability of information through time, how that might have changed some of the emotional responses? And then the second part was that from messaging standpoint, which it looks like you're already doing some work for.
Yeah, no, those are great questions. And it could be, I think that's a really great point that, we did see, over time, people became, there was a little more certainty. We learned a little bit more, right, about the virus and how it works. We learned more about the effectiveness of different types of protective behaviors. So that would, at least thinking from kind of how the emotional reactions work, if people feel less uncertainty, they may not experience as elevated levels of fear. And that's what we do see, right, throughout the kind of trends, for each wave. So I think kind of your intuition, is definitely right. As uncertainty was kind of decreasing a bit, we do see a muted emotional response. People still experience greater fear, but it's much less in kind of August than it was in, April when we did our first wave. And that's probably something we should, highlight a bit more as we're kind of finalizing our, manuscript. So, and then to get at the second question, how the messages change over time. Yes, what we should really be doing is pairing, right, our paper, since we're not doing an exact experimental treatment where we're, right, varying kind of how partisan elites are presenting, right, kind of information to kind of give a condition of polarization. It would be nice if we pair, some of at least what's happening during the waves of our survey with the messaging that's happening among political elites. And so we haven't done that piece yet. But I think that would be a nice complement just to kind of shore up, right, kind of how we're classifying what polarization and politicization around the pandemic looks like, at least when our surveys are in the wave, a little bit before and a little bit kind of, I guess, a few weeks leading up to our surveys. So I think that's a great suggestion, because I guess, so many people have lived through this that we know, roughly what's happening on the ground, but that's probably important context for us to add in and more systematically. So thank you for that.
Yeah, thank you for entertaining those questions, Jennifer. It's
Mm-hmm.
fun to follow along the talk.
Thank you. Let's see.
Jennifer,
Was Jenny?
Yeah, I think so. And then Krister. I'm not sure, John, you have another question? No, okay.
Thanks for this, Jen. It's pretty dope. It's really exciting to kind of see this incredible data you have, and to have it across multiple waves is super cool. So just intrinsically, the data exercise is great. And for me, when like thinking about this over time dynamic, it's really consistent with affective intelligence, right? Like Appendix B of the book makes the point that, anger needs to marinate. Like, it doesn't emerge immediately. It takes time. You have to learn to resent something. You have to learn to feel bad. And that you don't see this kind of anger effect emerging until the third wave. This is a nice demonstration of this kind of like familiarity breeds contempt argument. So I think you can use that as a kind of, a pitch, because the levels of emotion aren't changing, right? Like, it's really kind of remarkable how steady anxiety is as a general reaction, just as the constant for the control group even. I want to ask you what you make of sadness, because I find sadness to be one of the most interesting and fascinating pieces of this, because for one, it's not working in the opposite direction of enthusiasm. And to the degree to which we talk about sadness, we often kind of say it's the other end of the pole on enthusiasm. But in practice, when I put sadness in a battery of emotion items, it never scales with the positive emotions. And it's either a separate item or it's landing with the other negative emotions. And I don't know what to make of that. I haven't read, I guess, enough psychology to even know what to make of it either. It's sort of weird to me that it's associated with like acting behaviors, because when I get sad, I just vegetate. Like, I don't necessarily become more proactive about wanting protections and stuff. I just curl into a ball on the couch. And so I'm wondering what you're thinking about what's going on with sadness.
Thank you, Jenny. And thank you for reminding me of I think the first time I read affective intelligence was in graduate school, like one of the first drafts. I remember Mike was kind of sharing it with our class. So but I had forgotten about Appendix B, but also from some of the other scholarship. That's a great point for why anger is not emerging until later in our data set. And so that's really excellent. So thank you for that. Sadness. I was kind of surprised that the results for sadness are, pretty much the same as what we find for fear and anxiety. In part for some of the reasons that you articulated, because it is similar in terms of people are more likely to experience it when there's greater uncertainty, they feel less control, right? But as you know, you want to kind of direct your attention away from the threat. And so, we might expect that it wouldn't kind of have as strong of an effect on support for protective policies and behaviors. Now, and part of it just may be because of the behaviors and policies that are relevant for COVID. You kind of, if you need to shelter in place, like sadness, that's what you might already want to do, is kind of stay home, as you mentioned, and vegetate. So maybe because the policies are more consistent, with that, type of experience, maybe that is why, we're seeing kind of very similar effects, because they're all linked to kind of staying away from people, and kind of being your own little space. So I don't know. This is the first time I'm, kind of thinking, about why we may observe these kind of very similar effects. So thanks for raising that.
Thank you. And last question goes to Krister.
All right, thank you. So this is also out of my field, but I was thinking as you were presenting on the mediation analysis, looking at how the direct effect was basically null, but when looking at the mediation through sadness and fear, you saw an elevated likelihood of actually taking action, and I was thinking now that we have a vaccine and more people getting protected, we might see a different mediating effect where perhaps we're too fearful to actually go back to normal, and we kind of have this overestimation of the risk. At least that's what some people are suggesting, that to return to school, for example. Some public health experts say that the risk of a child getting hurt or even killed by COVID is less than, driving the kid to school would have a higher risk. So I just wonder, what can you say about the current situation, kind of a learning from your study about what we might do for messaging or try to overcome fear and sadness that we might experience from trying to re-enter into a normal life?
No, that's a great question. And I'm sure we're all, observing this right in our daily lives as, kind of people are getting vaccinated and you're starting to get together with others, but noticing, right, everybody seems to still have a different comfort level with what they do and whether they send their kids back to school. And so it's not, people may, right, that may be an important moderator of an effect, right, whether people kind of their own perceptions of risk once they've been vaccinated, right? If they've been vaccinated and are exposed to case counts, maybe, right, they wouldn't have as elevated fear as kind of what we were dealing with, when our studies were in the field, kind of vaccinations weren't available yet. And so that might be an important kind of moderator to reactions, I think, especially, in the current environment. But, as you note, that may not be the only thing that matters, because even among people who have been vaccinated, we still see kind of these very different perceptions of risk. And so, we may need to also have some measurement for just kind of risk perceptions. And that is a mechanism that we don't really look at in this paper, but may be an important alternative mechanism or important moderator for the types of reactions that people have. But then that leads to interesting questions that I think you raise for, how do we kind of help make people better aware of the actual risks that they're facing, right, once they're vaccinated. And so, as I mentioned toward the end of this talk, that's, some of the things that I'm really interested in are, kind of combating, some misperceptions that people might have. And so that's a great area to really think about, is how do you combat when people are kind of overestimating the risk, especially with respect to COVID. And so, I've seen some, kind of just, I don't think I've seen academic studies quite yet on this particular question, not that they don't exist. I may have just not seen them yet, but, if you expose people to that information about kind of the risks of, a child dying from COVID with vaccination rates compared to other risks they face, does that make people kind of less worried? And so that's a really excellent question. It would be a great, right, kind of follow-up study. So thank you for that.
Thank you.
Jotting down future experiments that we can run.
All right. Well, thank you very much, Jenny, for an excellent talk, and thank you all for coming again. And this wraps up the academic year, believe it or not. So we'll be back in the spring with some hybrid format at the very least. All right.
Thank you all so much for all this really helpful feedback. It was great to see so many familiar faces.
All right. Thank you, Jennifer. And thank you, Fernando.
Thank you.
Thanks, Jenny. It was great.
Yeah, great to see you, Jenny. Thanks for your comments. Those are great.